general, historically, facelift operation is pretty straightforward, and it has been done for many, many years with general anesthesia. The only thing that now has changed over the past 3 to 4 years is that we can still do this relatively large procedure with some oral sedation and local anesthesia. And I have, over the past 2 years or so, 3 years, been doing this for patients that are interested in not having general anesthesia. And so I have found that these patients that are done under local anesthesia, like the 2 patients that you interviewed earlier, recover faster. They don't have the after effects of general anesthesia. It is less expensive because you do not have to pay for an anesthesiologist and for a surgery center. However, it still must be safe, and that's the key.
And the facelift is the same facelift, so it's not different than the...
Correct. It's the same facelift that I've been doing for many, many years. I haven't changed it. I've maybe increased it a little bit, improved it. Yeah. As time goes on, we just don't want to do something we did 35 years ago. And it's just as invasive, if not a little bit more invasive. It used to be that the early facelifts were just taking a little bit of skin out from around the ear, putting some stitches in. It didn't last, it didn't look very good. And, but I do the same exact facelift I do under general anesthesia, I do under local anesthesia, yes. More and more plastic surgeons are going to now start doing facelifts and eyelid surgery under local anesthesia. When we talk about the actual procedure of facelift, I don't have numbers to back up what I'm going to say, but it's definitely logical that when you do a facelift under general anesthesia, there are more complications. Now, what are those complications? Number one, there's the complications of anesthesia itself, nausea and so on and so forth. Number two is that just like when you're flying in a plane, the most dangerous times of anesthesia are at the induction and when you're coming down. And that can be sometimes difficult and it's out of the control of it is totally under the control of the anesthesiologist. Thirdly is that we always are concerned about high blood pressure. And with general anesthesia, even though the medications that the anesthesiologists are giving lowers the blood pressure frequently, but when the patient is now coming out of anesthesia, they're feeling some discomfort and pain. They have a tube that's breathing for them that they're fighting, that feels very uncomfortable. Their blood pressure goes up, they start fighting this, and therefore their face starts to swell, and that's when one can get what we call a hematoma, or bleeding underneath the skin, which is the most common complication of a facelift, which is something that we want to avoid at all times. And so those things cause these problems. Also, post-operative nausea and vomiting. When you vomit, you're increasing the pressure in your face and in your head, and therefore also increasing the chances and possibilities of having what we call a hematoma, or this bleeding.